everybody. It's Amanda Stanton from the Parkinson Canada events team. Thanks for joining us here today. And thank you to this very dedicated group of super walkers that we have on the call today. As you all know, you're here today because you qualified via the SuperWalk the Movement campaign that we have hosted this summer. And this fantastic opportunity today here with Dr. Strafella is the result of June's Movement Challenge. So yes, thank you again for joining us. Much of the conversation today is going to be focusing on the Canadian Open Parkinson Network, or the C-OPN. The C-OPN will bring together Canada's best in Parkinson's research and will give them a platform to share information and make new connections. The network will give investigators access to unprecedented data and will support large-scale, multidisciplinary projects that would not be possible at a single research site. So that being said, we're going to hear more about that in a minute, but I want to welcome our special guest here today, which is Dr. Antonio Strafella. I'm just going to give you a little bit of background on him before we get started. So Dr. Strafella is a Canada Research Chair in Movement Disorders and Neuroimaging, professor in the Department of Medicine, Division of Neurology at the Toronto Western Hospital, University Health Network, University of Toronto. He is a senior scientist in the Krembil Research Institute at the University Health Network and a scientist in the Research Imaging Center at the Center for Addiction Mental Health. He is also a faculty member of the Institute of Medical Science at the University of Toronto. Dr. Strafella's research studies have been funded by several granting agencies, including Parkinson Canada, and he also serves on the Parkinson Canada Board of Directors. So Dr. Strafella is going to tell you more about his research focus in a few moments, and we'll get to that. But please join me in welcoming Dr. Strafella. And right now I'm going to pass it over to my colleague, John Collins, who is going to lead us through the discussion with Dr. Strafella today.
Yeah, thanks, Amanda. So I do have a few direct questions to ask of Dr. Strafella to allow him to introduce himself and the network. And then we have some questions that came in from you in advance, and hopefully we'll have some time to take questions from people who are here as well. But I will just go ahead and get started. And if you could, please tell us about yourself and your work in the Parkinson space generally.
Yes, so thank you first to invite me. It's a pleasure to be here to, of course, give my experience to the group. And my own, of course, interest in the field of Parkinson is mainly related to my clinical work because as you just mentioned, I'm a movement disorder specialist. And my practice is basically focusing on Parkinson and atypical Parkinsonisms. So most of my research is indeed done on patients that experience all different kinds of symptoms, and using advanced imaging technologies that are available here in our center. So I'm one of the members, of course, of the C-OPN, of this Canadian Open Network, and we initiated this project about a year ago, and I'm very happy now to answer any type of questions that would like to hear about it.
Wonderful. Well, that first question is a very good segue into my next one, or that last statement, I should say, is a good segue into my next question. We've been talking a lot about the network during the SuperWalk campaign, and we know that our community is excited about it. In fact, I know personally that some of the participants today are very familiar and engaged. So knowing that they're so excited about it, can you just tell us a little bit about specifically your role in the network and why you personally chose to be involved?
Right. So, of course, because I'm we define a clinician scientist. As a clinician scientist, I'm very much interested in understanding Parkinson's disease and what are the mechanisms responsible for Parkinson's disease. So with a group of colleagues across Canada, across different universities, we decide that alone, each one of us is probably does not have the resource of also the infrastructure to challenge and discover the mechanisms responsible for Parkinson's disease. So a couple of years ago, we decided to come together as a group in order to basically come up with a network, potentially a research platform that would allow us to bring the data together and to become very strong nationally and internationally as well, in order to make some discovery in Parkinson's disease and atypical Parkinsonism. So this would not be possible without the collaboration of the different centers across the country. So this was the initial idea, and now we're working on this initial idea altogether.
That's great. Well, thank you. And you've highlighted collaboration as kind of a key point for clinicians and researchers with the network. Maybe I'll just ask you to expand on that, or even can you tell us broadly what the Canadian Open Parkinson Network is and what it means to Parkinson research, or what the potential, I suppose, you see is?
Right. I mean, what it is basically, this is an initially funded project by, of course, in collaboration between Brain Canada and Parkinson Canada, where we have the opportunity to create this national platform where patients can register online, and we have basically a website, active website, and this would allow us to start collecting data nationally across the different centers, where patients would be asked to submit a number of scales, or also collecting some demographics data, and eventually this will evolve into something more in the future. So basically, at the moment, the plan is to have this research data collected nationally, and eventually we'll be able to collaborate internationally with other centers around the world in order to come up with some important questions for Parkinson's disease, and also answers if it's possible.
That's great, thank you. So speaking of those questions and answers, just in the general sense, what do you think is one of the most important research questions that we need to answer if we look to accelerate toward a cure, and can or how can C-OPN help with that?
Right, of course. I mean, the most important questions at the moment, there are a number of questions that we would like to, let's say, answer. But I would say that one of the most challenging now is, of course, how we can, at least in the near future, diagnose patients with Parkinson's disease, let's say, in the preclinical state. When I say preclinical state, is basically patients that have not experienced yet the symptoms, and we know that there are some biological changes occurring in the brain that we are not able to detect at the moment. And it would be nice to, very important to identify these changes very early on, before the clinical manifestation of the symptoms, because at that stage we might be able to make some changes and have a significant impact on the trajectory of the disease. So that would be probably the most important question that we should try to answer as a group at the moment. So start focusing on the preclinical stage of Parkinson's disease.
Thank you. And just to maybe hone in on that a little bit, you mentioned the role of collecting data, but how specifically do you see C-OPN helping in identifying some of those preclinical markers?
Right. I mean, how specifically? I mean, the most important thing is always to have a close collaboration with patients, of course, because they are the main stakeholders of this initiative. And so if we have a large representative sample of patients across the country registering to this let's say initiative, then we have a very good chance that we could have a nice representation of the demographics and of the disease, because the disease has a huge variability. Not every patient is the same. So having a larger representation of the different stages of the disease from early to advanced will allow us really to get a sense of the trajectory of the disease over time. So the most important thing for us would be to have this large, let's say, representation from participation from patients to the initiative, because that is the only way for us to really try to understand the disease, how this starts and how this progresses over time.
It's great. Thank you. And we're doing such a wonderful job of carrying this conversation on its arc. You've segued very nicely into my last question, and then I do have some advanced questions that came in from the audience. But why then should people with Parkinson's or others, why should people register for the Canadian Open Parkinson Network?
Right, exactly. For as I just mentioned, it's very important for patients to participate in this. And when I say patients, I don't have any specific, let's say, restrictions in terms of the stages of the disease. Everybody is welcome to participate. The reason why is because we want to really understand the progression of the disease and how this evolves over time. And of course, why certain patients develop certain complications and other patients do not develop other complications. So this is, for us, is still a mystery, even though we know that there is a degenerative process in the brain. But it's interesting for us to see patients that they deteriorated so quickly for a certain group of patients, and others instead the deterioration is extremely slow. So we don't really understand why the brain works like that. But the only way for us to understand is to have, of course, a good participation from patients to this project in order to come up with some answers. So definitely it's very important for them to be engaged in order to contribute to the science of Parkinson's disease.
Yeah, and that's one of the things that, just as an Parkinson Canada and someone generally aware of the network, is most interesting to me. It's that collaboration, or the role for each party between people living with Parkinson's and then the clinicians and researchers as well. And that's what I so value, is that there's a chance for everyone to play their part in unlocking some of these mysteries that you mentioned. So, I'm glad that you highlighted that. As I said, it was a very brief set of formal questions, although I think I found that quite illuminating. We do have 2 questions that came in advance from the audience. And then for anyone who's here, if you'd like to ask a question via chat, Amanda and I will keep an eye on those and ask them. Or there is an opportunity, if you're comfortable, that we can just, you can unmute yourself when called upon, or we can unmute you just to have a discussion. That's the idea today. So thank you. No but the one question I do have, or one of two, you've talked a lot about people with Parkinson's and their role. Are the participants, the registrants in the network, is that limited to people with Parkinson's, or is there a role for care partners and others?
Right. Actually, this is a very good point. At the moment, is very. The focus of the project is mainly on patients with Parkinson's disease. So that would be the first, let's say, level of this initiative. Of course, that would be a second probably level of the initiative, having also the caregivers to be involved in this project, because they would have also an important contribution to this idea. So, these are not exclusive, in the sense that we at the moment, we are not saying that caregivers should not participate in this, because we have a different stages how this initiative will evolve in the future. But to start, because we decide to start in a certain small and then eventually evolve to a bigger, larger scale. So we start focusing first on patients, and then start also incorporating the different aspects of Parkinson, like multidisciplinary and caregivers. So this is definitely something that we have discussed among the executive committee for the future evolution of this project initiative. That's
great. Thank you. And then just one last, again, I guess, about the participant experience. Can you tell us what you know about the process when someone registers? What type of information is gathered under C-OPN, and what's the process like for the person? Right. Generally, what happens is once the patient goes online and register, depending on where they're coming from, if it's British Columbia, Ontario, Quebec, so they will basically be assigned to the local institution that is in charge from Quebec, for example, or from Ontario, British Columbia. And so, and what they do is entering some demographic initially, some demographic information. And then once they also have signed the consent form for the study, we will forward as well a number of scales, clinical scales, in order to collect more specific questions about Parkinson and when did it started, what kind of symptoms the patient has. So
all kinds of different clinical information that for us will be useful to know in order to monitor the evolution of the disease.
That's great, thank you. And I guess one follow-up question to that from me, at some point, and this depends on the center, I believe, but there is an intention for a clinical assessment and perhaps even some biological information, is that correct?
Correct. So we have also the option of collecting some blood samples in patients that are willing to do it. And generally, we have this blood collection sent, once it's collected, sent to get back to McGill, where they have a biorepository of this blood collected. And so we will do some genetic analysis and also other biomarkers that we think can be important for Parkinson's disease. So we have centralized the data collection in terms of demographics will be collected and centralized in Calgary at the University of Calgary. And instead of the blood sample collection will be collected and deposited, stored at McGill. So and this, of course, everybody will be able, all the scientists involved in this project initially will be able to basically assess or also get on hold of this data for any type of analysis that they would like to do in the future.
And forgive me for monopolizing the questions, although I see only one more in chat, so I'll ask it. You know, you've talked about that, the importance of aggregating information and the collaboration between centers and that clinicians can access different data. Just for perspective, I wonder if you could share how challenging it is without the network, say, to collect all that information for an individual researcher.
I mean, it's extremely challenging. The reason why is because now, at least I can give you the example of many other countries that, for example, in the US and Europe. So there has been a trend over the last 5 years of scientists getting together to collect the data, because as a single center is very unlikely that you have the infrastructure and the resources to conduct certain types of analysis, like, for example, genetic studies, right? So genetic studies are done only in certain centers that have a very sophisticated infrastructure, or also imaging study is the same story. So the reason why we are getting together and to bring all this data together is because alone would be as a single institution would be very difficult to address these questions. It has to be a network of people, and eventually this national network can collaborate also internationally with other similar initiatives that are at the moment occurring in the US and in Europe. So there are very similar initiatives at the moment all over the internationally, yeah.
Right, that's great, thank you. It should surprise no one that a man with Dr. Strafella's credentials is very astute, and you're segueing again to a question you didn't know about. It's in the chat. About those international programs, what are some discoveries that you know of that might have come out of existing registries that give you hope about C-OPN?
Right, I mean, actually the biggest example has been in the field of Alzheimer's disease. So there is a large network that was developed in the US. It's called ADNI, actually, and is linked to Alzheimer's disease research and clinical analysis, where basically there's been very important discoveries in terms of progression, evolution of this aggressive disease, right? Neurodegenerative disease. So, and for example, like accumulation of tau pathology in certain parts of the brain, or also even you can now detect this tau, for example, in the spinal fluid. And so, and before, I mean, for example, Alzheimer's was just associated with amyloid protein, for example. But now we know that actually amyloid is important, but tau is even more important than amyloid. So this was the consequence of this group of people working together in the US. And this was is sponsored basically by the NIH government, federal government. So it started with as a small group study, but then evolved into a major enterprise that is now national supported. So the same thing will eventually envision. I mean, we're trying to envision the same thing for Parkinson. And so, because interestingly, Alzheimer's in terms of research is a bit more advanced stages than we are in the field of Parkinson's disease. And so we hope that we're able to raise more awareness across the globe internationally by having these initiatives.
It's wonderful. Thank you. I know we have one person waiting to ask a question at least. Pat, would you like to share? Oh, and Pat, you're on mute. I tried to unmute you from my side, but I can't do it.
Sorry about that. Thank you, Dr. Strafella. We have met before. I did participate in some research in Toronto, and then I moved to outside Ottawa in the country. And we haven't had access to, at least I haven't been, since I've been here, it's harder to have access to research. So I'm very pleased that Ottawa will have a center. And I'm hopeful that we'll be able to really get a lot of people from the rural areas to participate, because they go to Ottawa anyway, many of them for their treatment. And also I've been at the World Parkinson Congress when I've seen how people benefit from being together and participating in research and having that kind of interaction and exchange. How long do you think it's going to take before we can actually see something that we can tell people is going to happen? How far along do you think it is? Because like I know I also participate in the Fox Insight program, and that's what I sort of compare it to. I know it's not the same at all, but for me, it's been so exciting even just to participate and feel like I've been able to participate in any way. So how long do you think it's going to take before we can really get excited about sort of seeing some real participation?
Now, I mean, you mean specifically for this initiative?
Mm-hmm.
Now, I mean, actually, this initiative has been launched actually very recently, like I think a month ago, and nationally. And so, and already a number of patients have registered across the country in two different centers. So my guessing is actually that there is enough enthusiasm now among patients, particularly to be very active in participations in research. So I think it will happen that because as you just mentioned, and you are the classical example, there are many patients with Parkinson's disease that are very eager to participate in research. So personally, given that this now is national, I mean, across the nation, across Canada, we have different centers, and Ottawa is of course one of our centers as well. So we are actually envisioning that in the future, we're going to also involve other universities within the country that did not participate in the first stage of the initiative. And so by also involving other universities, I think we're going to be able to really have a large contribution from patients from different parts of the country. So even, let's say, in Quebec now, we are considering other universities like that, because for example, in the first call, that was McGill, University of Montreal, but then we have also other universities within Quebec, Ontario, and BC, and other provinces that are willing to participate. So I think in the next 3 years, actually, we should have a very good representation or participation from patients.
Thank you. Are there any other questions out there? We've got about 6 more minutes of Dr. Strafella's time, and a question from a peer.
Alex, I know Alex very well.
Hello. Hello, Dr. Strafella. Thank you very much for this great presentation. I was actually wondering about the network. Is there are there any main research directions that were being defined already by the network? I suppose that based on your research, one of the directions is the PET MRI acquisition. Are there any behavioral, cognitive, neuropsychiatric acquisitions also being considered?
Right. Yes. I mean, Alex. I mean, of course, Alex is in Quebec, so he's one of the people there from University of Montreal. So, I mean, we have a collection of, at the moment, actually, the majority of data are clinical, including cognitive and behavioral. And eventually, the second stage would be for us to evolve the demographic and clinical information into more, let's say, sophisticated technique like neuroimaging. And also, we would like to implement also if it's possible, some pathology. That would be another from the brain autopsies. So this is something that is a second stage for the future. But definitely, yes, at the moment we are collecting cognitive, we're collecting at least basic information like MoCA, for example, and the mini-mental state. Those are the basic cognitive evaluations. But then also behavioral for depression, of course, anxiety, all those kind of behavioral data that are very important in patients with Parkinson's disease. So those are part of the current data acquisition.
Thank you very much. Okay.
Yeah.
I'm sure we'd be happy to watch the two of you banter back and forth if you have follow-up questions, Dr. Hanganu. And failing that, I just have one final one from the crowd here, and then I think we're complete. And thank you so much for your time. More a general research question, but is there one particular area or stream of research, or even a particular trial that's going on that just that has your attention, that you've got a keen eye on?
Yes, I mean, there are actually few at the moment interesting study that we are trying to focus. Now, as you probably heard, there is a huge interest, at least in the near future, of immunotherapies, right? Like these immunotherapies for Parkinson, atypical Parkinsonism, where they inject antibodies to see if they can do any better or have any effect on Parkinson's disease. So this is something that we're going to see an explosion in the next 5 years for sure, because immunotherapies now are becoming a very important part of clinical trials internationally. And so this is something that different clinical centers are trying to engage more and more. It requires a very sophisticated infrastructure, so it's not very easy for smaller centers to do this type of studies, but I think it will be an explosion of initiatives in the next 5 years.
It's wonderful, thank you. And perhaps well-timed, it looks like we might be having some network slowdowns. So I believe that was all the questions from the audience, and I just wanted to say thank you. Again, for everyone's reference, I've been with Parkinson Canada for 12 years, and we've done a lot of meaningful work in the time that I've been there, but the goal of this program is stated as accelerating the pace of Parkinson's research, and I really believe that the collaboration, the data collection, and some of the specifics that you highlighted, serves those goals. So it excites me as a member of this Parkinson community, and I hope it excites all of you who are here today as well. So just thanks so much, Dr. Strafella, for sharing, and I'll hand it over to Amanda for some more formal thank yous.
Oh, thanks, John, and likewise. I'm really excited to hear about your work, Dr. Strafella, and looking forward to see where it goes. And thank you to all of you, to our colleagues, Lorena, Maria, and Julie, who attended today as well. A fellow board member for Dr. Strafella, Mike Sagers on the call as well. And to you, all of our amazing SuperWalkers, thank you for your commitment to SuperWalk the movement this summer. And we're looking forward to connecting with all of you over the course of the summer, and then of course at our virtual live opening ceremony for Walk Day on September 12th. So keep walking, and please do let us know if you need any help with your campaign. And once again, thank you so much, Dr. Strafella, for joining us here today.
Thank you very much for inviting me. It's a pleasure. And again, spread the words. So we need as many participants as possible for these initiatives. So don't give up. Just spread the words as much as possible. Thank you.
Excellent. Thank you so much, everybody.
No problem.
Take care. Bye-bye.